We are recognized for our research and care of patients from the National Cancer Institute. We are one of the leading transplant centers in the United States for patients with blood cancers. We're fortunate to have many new therapies that other cancer institutes do not have, and it attracts patients from all over the country to come here for their treatment. The NCCN is a National Comprehensive Cancer Network, and we were one of the founding members for that. We're designing the treatments and the guidelines that other cancer experts utilize.
When we're dealing with an incurable illness, having access to newer agents that are either better than what we have or as good with less side effects certainly benefits patients in the long run as far as their quality of life and their overall survival. Having a referral and an evaluation at an academic center usually involves the availability of either new combinations of drugs or new agents that have been proven to show as good a benefit or sometimes better. We have 3 new novel agents with better response rates, and in long-term follow-up, they have led to increased overall survival. More importantly, they give patients a better quality of life. We have newer therapies and surgical approaches. In the past, we may have radiated bones for more or less pain control and to slow the progression of the myeloma. But now we have better surgical techniques that are able to stabilize these fractures, both for immediate pain control initially, as well as strengthening the bones for the long term. As we are better at treating myeloma and patients are living longer, these surgical techniques reduce the risk of subsequent fractures.
My partner and I are the only 2 thoracic surgeons in the state of Nebraska who have practices that are limited to diseases of the chest, not including heart. We see many patients who not only have lung cancer, but have significant other medical and surgical diseases, that we have people who are clearly capable of dealing with all of those issues. And I think that is one of the benefits of coming to an institution that is able to provide those capabilities. The literature coming out now suggests that one's survival, not necessarily from a surgical procedure, but cure rate, which is what we're most worried about, is better when your cancer is taken care of by a team of physicians who have a dedicated interest in that particular disease. The group of physicians that treat patients with lung cancer is predominantly what they do. We try to run the thoracic oncology as a real multidisciplinary process. We really have the only group that has surgeons, pulmonologists, radiation oncologists, and medical oncologists that have a dedicated interest to thoracic cancers.
Multidisciplinary approach is when we have physicians in several different areas, such as medical oncology, surgical oncology, radiation oncology, that specialize in just one area. We also have hematopathologists that help us with diagnosing the patients. The first diagnosis and the proper diagnosis is very important for patients.
We have pathologists that are dedicated to the various diseases, and this is what they see mostly throughout the day. For us at the Nebraska Med Center, our pathology department certainly is able to set us apart at arriving at accurate and correct diagnoses.
We see a lot of patients who come in from a couple hundred miles away, and what they like is that they can come in. We have everything set up. They get all their testing done the day that they wind up coming in. They'll sit down, see me, go over everything. They'll get to visit with the anesthesiologist that day and then have surgery the next day. So this way they don't have to wind up, doing a lot of testing, doing one thing one day, another thing another day, and then go home and then maybe have to wind up coming back because, again, they're all busy. They have, farms and businesses and things that they need to attend to at home. And so it really facilitates it for them to be able to come and get it done in an expeditious fashion.
For our patients, we have them not go to the emergency room. They come to the lead transplant center, which is open 24 hours a day, 7 days a week. We have someone that's in the hospital on call at all times so that they can bypass the emergency room. Don't get the germs, don't get the delay, and get taken care of by someone who's a specialist in cancer immediately.
We have a really outstanding group of nurses. I think we've done a good job with centralizing patients that have similar diseases into specific areas. So the nurses too are able to develop an expertise, and that too I think provides greater comfort to the patients that they know that they're being cared for by someone who's really there at the bedside, and they're able to answer their questions and take care of any of the situations that wind up arising. They're the ones that really are integral to, making this run as a very seamless operation. They do all the scheduling, they communicate. There's a lot of emailing and everything that goes back and forth between the nurses and the physicians saying, this patient needs this is going to happen then, and just try to make it, especially for the patients who come from longer distances, that they don't spend a lot of time having to sit around with nothing being done.
The patients always come out of the hospital saying that our nurses are the best in the world, and I certainly believe that because they take wonderful care of our patients.